Have you ever wondered about the efficacy of acupuncture? Why is it this 1,000-year-old modality is still relevant today, and what can it actually help with? Today I have the pleasure of speaking with Dr. Troy Singh, who is a recent award-winning TCM practitioner based in Hong Kong. He was the past president of Hong Kong Medical Acupuncture Association. Like myself, also raised in Australia, he has a master's in studying the neuro-physiology of acupuncture and is the co-author of Health, Beauty and Vitality, A Woman's Guide to Chinese Medicine. We covered many topics surrounding traditional Chinese medicine, and Dr. Troy helps to unpack many of the concepts that can be quite confusing initially. We cover things like how acupuncture can actually release different classes of endorphins depending on the frequency, how TCM views men's health and the cycles according to the Chinese Emperor's Classic, what exactly is qi, and if Dr. Singh's perspective on it has changed over the years. How Dr. Singh comes from a background of both biomedicine and also traditional Chinese medicine. We go into things like what are the actual differences and how do they actually view things differently. We also talk about things such as how TCM is an open system and how new developments within the past century, such as EMF, heavy metal loads, plastics, can be viewed within the TCM framework. We also talk about TCM and pain management, what the pulse might feel like for someone with accumulated dampness, and much more. So without further ado, I hope you enjoy this episode as much as I enjoyed learning and speaking to Dr. Singh. We will also be launching a masterclass series helping to explain more about what is body constitution according to Chinese medicine and how you can understand it better and understand more about the different natures of food and your own unique body constitution. Stay tuned at wellnessjourney.co. So how did you start your TCM journey?
Oh, this is an interesting story.
Yeah, I'd love to hear.
So when I was growing up in Australia, Sydney, my mom used to help. I'm from mixed interracial marriage, so my mom was helping Chinese to resettle, or helping anyone to resettle into Australia. So we had a lot of people coming from Vietnam, and then one person or a group of people started coming in the 70s from China, and there was one doctor called Dr. David Tai, and he came and settled into Australia, and he was a TCM doctor. When I was about 12 or 13, I had a glandular fever where all the glands swelled up in my throat, and my mom took me there and had my first experience of doing acupuncture, and he just had this amazing technique that when I was laying there, I placed these points around, and then I just felt this thing just lift out, right?
Oh wow.
Yeah, and it was pretty immediate. Yeah, it was pretty immediate. I mean, because I couldn't talk at that time because it was so sore in my throat, and I could feel the pain just drift away within the session.
So was it what points was he
He used some down in my arms. Now I imagine he must have used Hogu and anyway, some points down here on my arm, and then some localized points, and I had this amazing effect, and I was pretty intrigued. I only went for a couple of sessions, and I sort of forgot about it, and then school ended, and I had my choices to enroll in different. I was thinking to do medicine or veterinary science, and then my mum was still friends with him. He said, "Oh, you should have a look at Chinese medicine. They're thinking to go into the universities in Australia." Yeah. I said, "Oh, really?" And
so where did he come from?
He came from Beijing. Yeah, he was from Beijing. That's where his last place he was stationed was in Beijing.
Oh, okay.
Yeah, so he was saying, "Oh, you should, have a look into Chinese medicine because it's probably going to be a biomedical, bioscience. And if you don't like it, then you could just swap over. It's like you do your first couple of years."
And it's quite early for internationally, right?
Yeah, this was
Chinese
this was 84, the 85. Yeah,
so
still young,
what do you
right?
learn about in the first year? Is it the different constitutions?
Yeah, we learned
acupuncture and.
Yeah, we learned about. You have to do the theory. That we do learn two streams. One is the Chinese medicine theory, but it was all translated into English. They brought the course from the Nanjing College of Traditional Chinese Medicine. And so they would do biomedicine, like 2 years, first 2 years of medicine, and then the Chinese medicine, which were two distinct ways of thinking. And so I went through that process
of two different ways,
combining them together, which is what they do within China, because it was a China course. They do a lot of biomedic, and then you do your traditional Chinese medicine, what they call traditional Chinese medicine.
So how is the biomedical different to like the traditional Chinese in the sense of what you're learning?
Oh, it's totally different. It's like, biomed's all analytical thinking, and Chinese medicine uses a lot of didactic. That means type of imperial type of learning where you using both literature, both hands-on and experience to understand how that medicine system works. And there is a framework, definitely is a framework. Framework is what they call a system of correspondences, whereby things correspond, usually within the seasonal patterns. Is the very commonest way that we call it the 5 elements now. Wood, fire, earth, metal, water. Those groups. So that was pretty interesting. Anyway, coming back to David Tai. So he did this course, right? And that was that must have been 80, 79, 80. And then when I finished my course down in Australia, then I went and worked in drug and alcohol, and I worked in a rehab facility down in Melbourne, actually, down in the Dandenong Wet Ranges around Pakenham. And they used to have a detox unit in St Kilda, and that was called Windana.
So providing TCM.
Providing TCM, I mean, amongst an array of treatments, both standard treatments for addiction, as well as Chinese medicine, natural therapies, exercise, dietary, like the whole gamut. And people could choose, or we could put together programs for them. So I was there for 2 years. I used to work in the therapeutic community, which is where people come up out of the city for 3 months and they live on a farm, and then we do treatments, in-house treatments and counseling, and then get them ready and then head them back into the world. So I was there for a couple of years, and then went up to China, did a training up there, and then met some people. They said, "Oh, come down to Hong Kong, it'd be pretty interesting down here. You may find some teachers." So I headed down here looking for something, right? Looking to how to improve my skill sets, and then I ran into a number of people over here, but that was all in Western medicine. So I went on and did a neurophysiology masters in how acupuncture works in terms of the biochemistry.
That's pretty interesting as well. I did see that.
That was, and the group I was attached to with Mabel Young, she was had a really keen interest in Chinese medicine and had identified a polypeptide that was extracted from the mushroom, and she had extracted this polypeptide for cancer. And so she was running some tests, and then she was also interested in acupuncture and addiction. She'd written a paper in 79, and that's how I'd found her, because I'd written a thesis on that particular area after working in Windana for a bit. And so she invited me into her lab and then allowed me to do all these types of experiments, which were pretty good, pretty interesting. One experiment we were trying to identify the difference between, we have different classes of endorphins. Endorphins are these things that we release under stress, and exercise, and they modulate pain and they modulate mood and these type of things. So we're trying to identify, how they work. Are they a hormone, and what blockers can be used? So we do acupuncture in.
I've heard that acupuncture can help release endorphins.
Yeah, that's right, which is one of the theories behind how it works for opioid addiction, is that by using acupuncture in a repetitive fashion, is that when people are using opioids, their receptors become hypersensitive to opioids, and then they just the body stops producing its own, and therefore there's a deficit between the opioids, and hence they have to keep increasing their opioids to to take away the imbalance from the chemical addiction, right?
So with like, for example, acupuncture, is it all points can potentially induce like the release of endorphins?
That's right.
Or is it?
Yeah, there's
particular points?
All points can, but some points work better.
Which points work better?
Ear points. Ear points, yeah.
Any reason why?
Yeah, I mean, I think the ear is innervated by two parts of our nervous system, the sympathetic and the parasympathetic. And it has a number of two different vascular.
Like ear seeding is so popular as well.
You see up there.
There are so many. It's crazy. Like there are so many points.
Hundreds of points up there. So, yeah, you can use those ones, and they seem to work the best. And particularly, there's a frequency to it. So if you use a low frequency pulse, so you'll get release of different types of endorphins. From 2 to 4, you'll get beta endorphin, which is a very common endorphin. But if you pump it up to 50 to 100, then you get dynorphins. Dynorphins are a different type of structure for those type of neurotransmitters that modulate mood, much more into the mood component.
Wow, that's crazy.
Yeah, it's pretty interesting. And then if you go above,
which endorphin, depending on like the electro
stimulation, which before used to be by hand, right? So you could do that by hand. So we have slow and fast techniques, like in traditional acupuncture. You use a slower technique to build up, or a faster technique to withdraw or sedate. So. But now with modern technology, you can use different ways to do this. And so we were looking at, what type will happen when you stimulate with different types of stimulations.
So like acupressure wouldn't work. Does it work?
It does, but but it's about, probably that's a more slower, because you can't speed up the repetition as fast with.
Sometimes people say like, massage your ears as well.
Yeah. So that's pretty interesting. So anyway, I did that research over there, and then I was still searching for, different techniques. And over the years, I've done a number of them anyway. About 10 years ago, with the internet, there's a lot of courses online. I came across this guy called Ed Neal out of the US. He's a Western doctor, very interested in Chinese medicine. And he was exploring the classics of Chinese medicine. The Wang Jing, these ones. And I was quite fascinated about that type of styling of acupuncture.
I actually spoke to a TCM doctor recently, and she said that they were able to kind of semi-predict that there would be somewhat like a pandemic through 黄帝内经.
That's right. In chapter 68 to 72, there's they use the Lu Wei, which is the six stems and 5 mechanisms to set out based on the earthly stems and heavenly earthly branches and heavenly stems, which is a system of mathematics that utilizes yin and yang as its basis and divides the calendar into a 30-day, follows the moon cycle. And through that, they attribute different types of factors. And within, actually, there's a chapter, I think it's 71 or something, that they go through and they predict, because it's a 60-year cycle that just keeps repeating itself. 60-year cycle. And they for the 2020 year, they were talking about the possibility that a type of disease would generate itself that would be characterized by very similar things that COVID has produced in itself, which is pretty interesting.
Mind-blowing, because
so we went through that. I've got that translation actually, not in my other computer, which is pretty interesting. We were going through it as that was playing out and trying to understand what formulas or strategies we could use within Chinese medicine to do that. And so anyway, I'm with this guy Ed Neal. We're in, and I've been following him for about 3 or 4 years.
So this was you weren't in the States?
No, I wasn't in the States. I was just online, and then every year we would meet up with a bunch of his other students, either in the US or in Europe somewhere. And this time we were in Rougon, south of France, down there. Anyway, so we rent out this villa, and then people from around Europe come in. About 20 of us come in, and then we do lectures and do practical techniques using this particular style of acupuncture. And so, and that style of acupuncture is really, really interesting in terms of its therapeutic effects. But anyway, I got closer with Ed and talking and just saying, it's a bit of a ways for me to come from Hong Kong to over to here in Europe or even to the US. Does he know anyone that maybe is a bit closer, whom I could study with, and then could always come, maybe every second year or at different times, because I really want to get on top of this particular technique. And he was going, there's this guy down in Australia, David White. He's also practicing this style. We've collaborated together, and we could maybe you could check him out and do some stuff with him. So, fantastic. So I got back to Hong Kong, text David. So, David, I'm introducing from Ed Neal. Yeah. He said that you're doing this similar technique. I really want to, know more and get on top. You maybe give me a little bit about what your background is. He goes, Troy, Aussie guy. So he's out of
US, Hong Kong, Aussie.
Yeah, Sydney. He's out of Sydney.
Yeah.
He grew up in Sydney as well, out at Crow's Nest. He goes, I started practicing about 25 years ago. Went through this college, the Sydney College of Acupuncture, and one of my teachers, David Tai.
Which is...
Yeah, I said, David Tai, like Paddington David Tai. He goes, I used to work up here. He used to have a practice up in Paddington. Yeah, he was so into this technique and his lineage that he learned from Beijing was taught by this guy out of Sichuan, and Sichuan was where Ed Neal had learned from his guy who's already passed away. Ed's the guy in the US, right?
So they all kind of learned from
one,
Sichuan.
From one particular guy.
So were there many different?
Yeah, there's lots.
Of lineages,
there's lots.
Even acupuncture.
Even acupuncture.
How many?
Well, I don't know. There's must be more than. Must be more.
So what about, for example, the ones that like the imperial family would use previously? Like would they just have a lot of different lineages? And
they would use
is
obviously.
Is there a dominant one? Like for example.
Obviously they would. The imperial family had opportunity to choose from the best, right? And whichever region or whichever discipline. So they may have favored a particular style over another style. And obviously at that time, in that 05 to 49 period, it's pretty chaotic.
It's crazy to think, because I think perhaps a lot of people who aren't too familiar with TCM, they might think, isn't a needle just a needle?
That's right. But
it's complicated.
But it's got a whole, there's a whole school and discussion and arguments that have followed through different lineages as they try to, dominate or express their ideas, like intellectual conversation, right? That's still open. So, I think, and then he goes, David Tai. I said, wow, really? Oh, my mom used to, know David Tai, and I went to him for a few times, and we started to get on, and that's the story. So here it was. I've been searching all over the world, into Asia, thinking, there's going to be more Chinese medicine here, but obviously, and now it's dispersed all over the world. Just like there's a style of acupuncture called Tong acupuncture, Dong's acupuncture, and that Dong. His name is Dong. Dong. And he was from China, but then settled in Taiwan, and so in Taiwan they use a lot of practitioners over there use that style of acupuncture. Because
so what kind of style is, for example?
It's a distal and imaging style. So rather than focus on needling acupuncture, where the problem is they will needle like on these on a distal area. So that would mean, say you have a shoulder or neck problem, they may needle down here on your ankle.
Like the meridian?
Related to the meridian.
Okay.
are not necessarily focused at the actual neck or shoulder area. Or for headaches, they may needle around
Is it
the
because
feet.
sometimes it can be coming from that point, but sometimes it could also be coming from the meridian point lower?
Well, their concept is that the meridian should be in endless circulation, free-flowing circulation, and when it becomes obstructed, the end result may reflect itself, in a neck or shoulder pain where you feel the pain. But there will be areas along the same meridian that goes through this area. So, for example, this area here, there's 1, 2, 3, 4. So there's 4 types of channels that may be affected in this area. So looking at those 4 channels in different regions, because they connect up through here, you can influence. You may find the tissue when you palpate or press the tissue, you may find that, there's bubbles there, or there's strong fascial lines, or the tissue is different than the surrounding tissue. So even massaging it, you may find, when I massage it, that person, neck and shoulder feels easier. And when we place a needle in there, then you feel,
So
it's totally
sometimes
changed.
when you go to like the foot massages,
exactly.
and they press your feet, and
Yeah.
they're like, this relates to your liver. Your liver's not very good.
Exactly.
Do you think that there is some validity in that?
I think it's an empirical science, right? And empirical suggests that through the use of it, you can see the result. Explaining the result within the parameters of modern biomedicine at this stage may be more difficult, but if it produces the end result, then it's up to us to figure out, how did we get to that end result? And which may or may not be available knowledge yet, right? So discounting it just because we can't explain it using a particular model of thinking doesn't suggest that it's not a reality. I think that's an interesting thing about Chinese medicine, that it asks the question, reality is a perceived construct that enables us to predict an outcome or a future, right? And that through using those types of theoretical constructs, then this may give us an opportunity to see how to change a particular outcome. It may not as well, right? If it doesn't, then clearly it's not useful, right? I mean, that's knowledge, right? That's what we call knowledge, the ability to know when things work or don't work. And if it's not working, then it's a bit of madness to keep doing the same thing, right? I think, all systems and Chinese medicine itself tries to understand that construct by giving us an ability to view the body or health in a different light than maybe we're viewing it at the moment in biomedicine or in any other format.
Because it's more holistic?
Well, because they just think that our body's connected to the environment, and the environment is either expanding or contracting in relation to the seasonal component. So in summer, we would expect things to expand, because what happens when we heat stuff? It expands. And in winter, when we cool stuff, things contract. So their thinking is, the body, maybe it does the same thing. So when we heat up the body, what happens? The pores expand, we sweat, pulse rate goes up, tissue flushes, gets warmer. That's interesting. Right? So it does follow some common, natural laws.
So then, that's why also they say, for example, in autumn it's a time to show, which is and then
to gather. That's right. So because many things in nature are doing that. You can see, within the plant system, is that a lot of the nutrients are being stored in the rhizome of the plant, because a lot of the exterior foliage in a number of plants, but not all plants, will fall off, right? and nothing will grow. But if the ground isn't cold enough, during the winter, then its expression in spring can be different.
Yeah,
So when
yeah.
you talk to farmers, they're always saying, oh, it wasn't such a cold winter. I don't know whether, whether it's going to be such a good, spring, sprouts, such like that. And I think the body, as I understand Chinese medicine, is they're trying to reflect those same patterns using the terminology yin, yang, and those 5 element constructs, right?
So fascinating.
Yeah, so it's pretty interesting. And that's what classical Chinese medicine tries to get us to think about, is that those constructs are in play, and they're in play in our body in a particular fashion, and that observing where or how they display themselves gives us an opportunity to, do a simple treatment, just like warm up the feet, or, more complicated treatment like acupuncture or Chinese herbal medicine or stuff like that. Yeah.
There's so much to dig into.
Yeah, that's right. So that's a long story. So basically, I thought it was pretty interesting that I should spend 30 years traveling around the world in Hong Kong. Yeah. And he's still alive. He's 90. He's 95. Well, I haven't been able to go. I haven't been able to get back since finding that out, which is 2018.
What are some things for people who aren't too familiar with traditional Chinese medicine that you think can be quite effective in treating?
Yeah, pain management for sure.
Yeah.
I mean, a lot of times utilizing or improving the blood flow and improving the circulation and reducing down the inflammatory response has major improvement in terms of functional status and reducing pain. So that's definitely one, and may save that person from needing to use heavy drugs when they may not necessarily need to use over a long period of time, and particularly degenerative conditions, like osteoarthritis, and then all those autoimmune type conditions, rheumatoid arthritis, these type of other types of lupus, SLE, systemic lupus erythematosus. This is like a type of autoimmune condition where our body turns against itself. There's more and more evidence showing the use of acupuncture in terms of reducing pain and managing pain, and even some of the herbal medicines in regards to helping to modify the immune response.
The frequency of the acupuncture treatments, does it depend on your own specific situation at that time?
Yeah, that's the way I view it, is that we see how that person responds. Usually the techniques that I'm using enable the body to respond in a very quick fashion. So we can see the extent of damage that is done when they're on the treatment time, during the treatment time, by how they respond, and also how well their body can hang on to that effect. That means, they may get 30 to 50% improvement of their pain pattern or of their functional movement within the session. But does that mean that every day from that moment forth, will their body be able to capitalize on that and improve it by a 20 to 50% improvement each day? This is it's not a phenomenon, it's just a natural, normal fact. It's like when the body.
There's also lifestyle factors as well. Right?
Yeah, I mean, definitely those factors play a role. If and people's own constitutional status. Sometimes they just don't have the resources available, and we can see that through those different types of tests that they have in Western or biomedicine now, that they're just missing components that their body.
Unique constitution.
Yeah, that's right. So in Chinese medicine, we describe, we have terminology that describes those type, and understand that, that's probably a management thing. It's not going to be able to get to resolve itself, but maybe able to support through the use of different techniques, breathing, for example, or lifestyle changes or dietary changes or things like that.
I'd love to hear your thoughts on qi and energy, and because everyone says qi, and also we talk about in yoga and how it's this vital force, energy force that is so crucial to beings, and it's not just in human beings and every living thing around us. I wonder if your perspective on qi has changed over the years and where it's at now.
Yes. Yeah, I think so. I think initially when I came in, I was, part of that Occidental type of Sino approach whereby, the concept of this, metaphysical ideas of, energy were very inviting and, opened up many possibilities, and it was very much like the idea that, there's this stuff that circulates, through the body that is described as qi. But as I've moved through my investigation and my practice, I think the qi that the Chinese medicine were talking about is probably more a construct of like a fabric of how the tissue plane is constructed, and not necessarily an energetic thing. Like I think it's a continual wrap of substances that allow the circulation of that concept qi to function.
Circulation.
Yeah, so I think that circulation's the most predominant thing I'm interested in, like where does circulation move, and where can we see that on the body? Does it feel warm? Does it feel tight? Does it look like it's moving or not moving? And the qi is that component, that fabric that allows that circulation to move through it, as opposed to previously thinking that it was, EM squared, right? It was a type of metaphysical energy that was,
Could it be also
stored.
still?
It could be. I mean, you can interpret. I mean, it's an open terminology. I mean, the character itself, has the radical for, food, rice underneath, and this horizontal platform with some wavy lines, which could be, what is that, heat rising off something?
Yeah, because in Hong Kong, I've been exploring Qigong.
Yeah.
And I find the movements, at least for me at the moment, are quite simple, yet it's quite effective in feeling this warmth kind of surge through my fingers.
Yeah, this circulation is improving, which is good. I mean, it's working.
Yeah,
it's
because
working.
I may not feel it as much from, for example, just jogging, whereas from doing the Qigong, it's more noticeable, maybe because my body I'm more slower with the movement, maybe there's more awareness. But definitely I have noticed it quite evidently.
That whole realm of Chinese medicine, Qigong, is fascinating, to be sure. And those practitioners that work within that field and use the exercise as a way to circulate that component, is very interesting.
But I wanted to ask, to talk a bit about men's health as well, right?
Sure.
When it comes to TCM, what are some things that you find TCM is quite helpful for when it comes to men's health?
Yeah, I mean, I think difference in Chinese medicine we describe in the very first chapter of Chinese of the Wang Di Neijing in the Su Wen chapter 1, they describe the cycles, the life cycles of men and women. In women, it's a 7-year cycle, and in men, it's an 8-year cycle. And throughout each of those times of those 8-year cycles, different things develop. So when it comes to men's health, men follow a similar process, is that, before 16, then, their body's developing towards puberty, and then post-puberty, you hit that peak. And then when you hit the 35, the 36s to 40s, then you start to get declines, and that's all dependent on both your ability to collect the surrounding lifestyle, through your lifestyle, the things that you've experienced and the traumas that you've had, and then the decline occurs as our ability, our digestives and other abilities are less able to collect those things from the food we eat or the exercises that we do, and hence you will start to see a series of conditions being caused, degenerative joint problems, definitely on the internal side. You see liver issues, heart issues, and then other manifestations of accumulation. That means where tissue and inflammation start to build up in different areas, commonly for men, prostate, right, when they hit their 50s to 60s. So Chinese medicine addresses those different stages with different treatment strategies. So they may use diet and exercise in the earlier phases because there's less structural damage, but as the structural damage takes hold, then there's less options available. Definitely there's still benefit from following what they call a rounded diet, but eventually with the structural damage, then you need to use biochemistry to help to improve that. We use Chinese herbs as our mechanism, trying to strengthen those areas, and looking at, for us, we use the pulse as a mechanism to understand how circulation is moving to the different regions of the body. And when it's out of position, then we have a series of herbs that we think correspond to those components. So if the pulse is pushed down, then we want to lift it up. So we may use herbs that then lift up it within different regions of the body. So for example, we see a lot of cholesterol components showing up, between 35 to 45 in men. And we may find that their pulse in some positions because cholesterol is seen as a type of dampness or blood stasis. It starts off as damp. Dampness is a type of humidity or fluid that the body's unable to transform and transport out of our system, and it lodges itself at different levels. So it has a dampening, like a cloud, like a water or dampening, not like a non-physiological type of fluid. Dampens, presses down, reduces circulation. So in the pulse, we may find that when we take the pulse is deep and spongy, feels like a sponge, right? Because there's something going on there. So we would use herbs that maybe are aromatic, that assist the body to transform and transport that dampness out of the body. So may use things like Rhizoma scutellaria, yin chan hao, which is one of those anti-malarial type drugs, Artemisia, that woman got the Nobel Prize for, the Chinese doctor, Dr. Yu, right? So, and malaria is also seen as a type of dampness. So can be seen as a type of dampness that inhibits the body, so that they're using it to lift out. But in Artemisian, the extract, they're obviously just using one of the active ingredients of the herb. In Chinese herbal medicine, we very rarely use just a one herb. We try to build or construct a formula that reflects the person we're seeing in front of us, looking at whether the pulse is either elevated in the upper part of the body or depressed, and then at the different 3 levels of the body, using the formula to address those 3 levels and the relationship based on our physiological understanding of how that works, to assist those organs to function, or zhong fu we call them, to function at a better state. Yeah, like this. So for men, so for men, coming back to men, so that means like, we may be able to treat. I mean, obviously, by medically, we see that it's often that testosterone starts to drop down once men hit around 40, 45, right? So there's a lot of herbs that help to build. They're not hormones in and of themselves, but when our body takes them in a particular format, in a formula, then we see if we take blood tests that the hormonal component changes. So, for example, the herb yin yang ho, herba epimedii, that's a Latin name. This one, when it's used together with ba ji tian, which is morinda, those two herbs work synergistically together to help the body, the testes and the adrenals, to start increasing their production of testosterone.
And you will look at...
but we're not looking at those. We're not looking at those particular markers. We're just going off what we understand when we have our conversation with our patient and through the pulse.
And in terms of the herbs, I think that's where Chinese medicine is so fascinating.
Yes.
Because you will prescribe different herbs depending on their individual constitution, right? Like,
That's right.
These herbs may suit this particular person, but may not suit another.
Yes, correct. Yes, we're trying to understand the movement of fluid and the functional status of that person by using different regions to observe how that circulation is. So the pulse, the radial pulse is a particular region. We can look at the tongue as well. The tongue gives us information about the digestive function to some extent, and also about the quality of blood that's circulating, because you can see a lot of blood vessels and the color of the tongue, and that can start to instruct our questioning about, their sleep, what happens when they digest food, what happens when they exercise or don't exercise, and through that information, those more objective pulse measurements and tongue measurements, and then through the questioning and inquiring, and then other observations of the hands, and maybe we use the ears or the eyes or the face or the body structure. We start to build a picture of that particular person, and from that we can start to look at herbs through a system of correspondences, using that 5-element understanding that there is an interrelationship between the organs that in order for them to function, and that enables us to construct formulas. But a lot of the formulas, when we study we study a set number of formulas. Maybe there's like 352 or 350 type of formulas, and and those formulas, in our studies, we break them down into understanding which 2 herbs or 3 herbs work together as a synergy, and which ones work against each other, which give us an ability to do that. Yeah.
I'd love to hear your thoughts on this. Traditional Chinese medicine has been around for thousands of years. And I was speaking to a practitioner friend of mine, and they were kind of talking about the past 100 years. There's been a lot of new developments in our modern world, for example, EMFs, and so forth, and a lot more pollution as well in our world. So how does TCM address or look at these new developments?
I think Chinese medicine has a descriptive terminology to try to understand when a pathogen presents itself to our body. How does our body respond? And we try to divide it into 6 type of things: dry, damp, heat, cold, fire, like this. And giving a categorization to the presentation of those symptoms helps us to identify. It doesn't matter what you call the thing that is the pathogen. Whether it's heavy metal load, whether it's pollutants, whether it's BCBs, out of plastics. We're interested in Chinese medicine about what response do they kick off in your body in terms of those categories that we're given to understand how a body would respond when it's trying to defend or defend itself or respond to any environmental things that are not of ourself.
Yeah.
So it doesn't matter what that thing is, EMF or whatever. If it kicks a response in your body, then
What is that response?
what for us from our side, we're just interested in what is the response that it kicks for you. And then as we see that again and again and again, then we may see that, plastics are always, kick this response, or heavy metals always kick this response. Or we may find that, only certain body groups respond to it in this way.
I see.
So it's, from that point of view, it is a logic. They use that type of logic. They're still looking at, I guess, cause and effect, but they're not limiting to just one causal expression. That's the flexibility. I think that's a flexibility of the system. It's like an open system.
Continuously evolve and develop.
Yeah. So that enables it. I think that should enable it to continue to evolve and have discussion about humanity's movement into the 22nd century. I mean, that's what I'd like to think, and that it can add to the science, the body of science or body of knowledge that enables us as humans to, reach our potential. And a lot of that conversation, maybe in the future will come through collaboration with Western medicine, and as it is already starting in Chinese, in different countries. And, or will it be that, Chinese medicine just gets subsumed within modern medicine and becomes like a small, offshoot that, is used for some things, like nausea, acupuncture is used. You just use this point, and it's just like a formula, what we call a formula approach, where certain responses in Chinese medicine will be just picked up and utilized in biomedicine as a technique. So two ways it could go, right? At the moment, Hong Kong is trying to expand on the possibility that there is a integration of medicine. So hence they've got a number of courses within the university. And, once you've gone through your bachelor degree and got a bit of grounding in science, you can go on further and do those integrated type of research, in your master's and PhD in, that crossover between either looking at the biochemistry of particular herbs that work in a particular fashion and try to identify either A, the active ingredient, or B, the actual outcome. I mean, that's the general model of it at the moment, which is, it's not the best model, but it's a model, and it's an integrated model. And, through doing that over time, we may see, benefits.
I'm curious to how Chinese medicine, if they've explored looking at EMFs.
I think, that's Qigong, right? EMF is Qigong, right? There's the good side of that, those type of vibrations. And then obviously there's a negative side of those type of vibrations, right? I think that goes into all the esoteric components that, make Chinese medicine difficult to understand for someone who maybe is more grounded in a scientific approach, because it asks you to think about concepts in another way.
And finally,
I don't know where,
what do you have any favorite books you'd like to gift or recommend people relating to kind of traditional Chinese medicine?
Oh, my
you also have published.
Oh that's right.
Which maybe you could share your title.
That's Qi, Health and Vitality, and that was with that one is by Periplex. It was published by Periplex. But I think one book I'm interested at the moment is Classical Chinese Medicine by Lu Li Hong, and the Chinese University has just published it. It's a bit maybe it's a bit more, I mean, definitely it's more geared towards the practitioner.
Yeah.
But I think the young practitioner should read this to help them understand the positioning of the knowledge that they have already obtained and how to move that knowledge forward. I think he's definitely one of those masters that can verbalize. It's in Chinese and English, it's in both.
Yeah.
So they can help to verbalize the constructs of Chinese medicine. I mean, I started out reading Ted Kupchuk's The Web That Has No Weaver. Yeah, it's a very old book. It's an oldie, but a goodie. I mean, his argument, I mean, quite interestingly now, he's now studying very much the placebo effect, which is very interesting, right? Placebo being that, you know, the body under the right instruction can in itself heal itself, and you know, when it cannot be explained, they put it into this placebo effect, which is pretty interesting. And I think, yeah, that would definitely be an area of research that could work really well.
Thank you.